much does HIV treatment cost? The price of treating HIV has changed dramatically since the early days of highly effective treatment. Today, some treatments for HIV are generic and relatively affordable, while others such as long-acting injectables are among the most expensive medications out there. But regardless of price, HIV medications are almost always fully or partially covered by one or more public or private insurers. Otherwise, few could access them. How much does HIV treatment cost? This is a tricky question to answer, says Tim Horn, Director of Medication Access at NASTAD, which represents HIV coverage program administrators in the U.S. On paper, meaning the list price, many HIV medications, like all sorts of medications, cost more in the U.S. than anywhere else in the world. For example, says Horn, Cabenuva, cabotegravir/rilpivirine, the first and only HIV medication one needs to take only monthly or every other month, via injection at your healthcare provider's office, has a sticker price of roughly $4,000 to $6,000 per injection. But basically no patient pays that, he says, because their cost is covered, again, as is the case with most FDA-approved medications, via one's private or public insurance, such as Medicaid and/or Medicare, or various pharmaceutical assistance programs. And with HIV medications, specifically, a long-standing federal-state program called the AIDS Drug Assistance Program, ADAP, pays for almost all HIV medications for financially qualifying people who don't have or qualify for another coverage program. The program even often pays for co-pays and cost-sharing for people living with HIV who do have other coverage. In fact, ADAP covers medications for roughly a quarter of all people living with HIV in the U.S. Medicaid covers about 40% of them, while Medicare covers about 28%. What are the costs of individual HIV medications? Again, says Horn, the list price of individual HIV medications is generally irrelevant to the individual patient, because virtually nobody in the U.S. pays out of pocket for them. Having said that, he notes, historically, the list prices of new HIV medications in the U.S. have often sparked outrage among activists because they still need to be paid for, including by public programs that generally need to contain costs. ADAP, for example, has periodically experienced waiting lists for certain drugs in certain states, he explains, because the program in those states was not funded enough to meet the cost of medications with exorbitant new list prices. Today, ADAPs may be slow to add new drugs to their formularies or may need to put certain coverage limitations in place due to significant expenditures. With all that in mind, this chart with information from drugs.com shows the current monthly list price of HIV regimens for which all drugs are combined into a once-daily pill, which is how most people living with HIV in the U.S. currently take their medications. Atripla, $2,361 to $3,253. Biktarvy, $4,204, Complera, $3,825, Delstrigo, $2,831, Davado, $3,144, Genvoya, $4,202, Juluca, $3,708, Otafsi, $3,825, Stribold, $4,407, Simphy, $2,038, Centuza, $4,976, Triumec, $3,956. Horn notes, these are all-in-one combo pills. Obviously, list prices of individual HIV medications are generally cheaper, but regimens comprised of two or more single medications may actually be more expensive than single tablet combos. Here is a list of all HIV medications. What determines the cost of HIV medications? In the U.S., where there is little government regulation of drug pricing compared to other nations, pharmaceutical companies will price HIV medications at what they think the market will bear, says Horn. Often, drug makers set a record new price for a drug that offers improvements, sometimes marginal, sometimes breakthrough, over predecessors. For example, Fusian, the first injectable HIV medication, was priced at more than $20,000 per year, an astronomical sum at the time, when it was approved by the FDA in 2003. In the past decade, many HIV medications have lost their patent exclusivity, and generic versions have appeared. These generic drugs have brought the list price of many HIV regimens down dramatically, and thus have eased the burden on insurers and individuals directly impacted by high list prices, including those having to pay a percentage of the medication's price as part of their insurance requirements. Looking at the effects of generic medications on the market, Horn says, the monthly list price for the branded version of the extremely popular Truvada is about $2,000, but the generic version can run as low as $30. This has been a pretty major development when it comes to PrEP. He is referring to pre-exposure prophylaxis, which is when people who are HIV negative take Truvada or one of its generics in order to prevent HIV acquisition. In the HIV treatment space, says Horn, we're still largely dependent on high-cost brand-name drugs. How can you get your HIV medications covered? As stated in the introduction, almost everyone in the U.S. living with HIV has their HIV medications covered through one or more of the mechanisms listed below, job-linked coverage. Many people living with HIV, just like everyone else, have health coverage through their job and are all set. However, if you struggle with copays or other cost-sharing on your job-linked insurance, or are struggling to access certain HIV-specific medications through your employer's plan, ADAP may be able to cover those costs for you, if you are eligible. Contact your state's ADAP office. Affordable Care Act, ACA, or Obamacare, coverage. Plans offered through the ACA marketplace are private but are publicly regulated and subsidized. That means that if you are income eligible, a plan on the marketplace listed at $600 a month might actually cost you $300, says Horn. Also, ADAP programs in many states will often cover the entirety of your monthly premiums on your ACA plan, or they can enroll you in a high-quality ACA plan and may cover copays as well, for those who are eligible. Learn the specifics of your state here, but you may want to work with a case manager or social worker instead of attempting this all on your own. Medicaid and or Medicare. These are the two biggest federal health coverage programs. And their eligibility and offering details vary by state. Generally speaking, says Horn, you need to be below a certain fairly low income cap to get Medicaid, and you need to be disabled and or over age 65 to get Medicare. Some people, called dual eligibles, actually qualify for both programs, usually because they have some combination of being over 65, having a very low income with little savings, and having had, a disability that has limited work opportunities. For such folks, Medicare is the first payer, and Medicaid picks up the rest. It's important to recognize that manufacturer copay assistance programs can't be used to cover medication copayments, for Medicaid or Medicare. Notes Horn. ADAP and other Ryan White programs can, which makes them vitally important for lower-income people with HIV aging into Medicare. AIDS Drug Assistance Program. Again, this is the program that usually covers people living with HIV who have no other coverage and fall under an income cap. This cap can vary by state, but it is generally about $60,000 to $75,000 for an individual and more for multiple-person households. But, says Horn, it's also important to remember that many ADAP programs will cover all or part of expenses on one's job-linked or ACA plan, as well as the Medicare prescription drug costs, depending on one's income. Pharmaceutical Assistance Programs, PAPs. These are basically charity programs offered by drug makers, says Horn, particularly on drugs that are so expensive that public or private payers won't cover them. As with public programs like Medicaid and ADAP, one must fill out forms to verify one's income eligibility. The two biggest non-generic HIV drug makers in the U.S. right now are Gilead and 7D. Info about their PAPs is here and here. If you need coverage of HIV medications or are struggling to pay your share, such as copays, of your medications, consider reaching out to your local HIV/AIDS services organization or HIV specializing health center for help exploring these options, urges Horn. Often, they have case managers and social workers who can do all or some of the work for you, and turn what can be a complex and overwhelming process into a manageable one. What are the takeaways? HIV medications in the U.S., like many medications, often have exorbitant list prices. Seldom do those prices reflect what a patient has to actually pay, because there are a number of private and public coverage options that pick up most if not all of the actual price. Working on your coverage options with a staffer at a local HIV agency or health clinic will likely be easier than trying to figure it out by yourself.